Hello everyone, welcome to today's lecture Indirect Tooth Colored Restorations Part 2. Topic learning outcomes. Last class discussed about the direct and indirect restoration, inlay, onlay, indication, contraindication, advantages and disadvantages of indirect tooth colored restorations and summarized with CAD-CAM. Today we are going to describe briefly the clinical procedure, impression making, provisional restoration for indirect tooth colored restoration. So clinical procedures. So that involves two steps. That is first sitting and second sitting. So the first sitting involves tooth preparation, impression and temporization of the restoration. Second sitting involves trying, cementation, finishing and polishing. Tooth preparation. So in each case the first step is anesthesia if it is required. The patient should be anesthetized and the area isolated with rubber dam. Once it is done, the compromised restoration, if any present, is completely removed and all the caries is excavated. The walls are then restored to a more nearly ideal form with a light cured glass ionomer cement or a composite restorative material. So it should be a 2 to 5% divergence should be there. This is to prevent any undercut present over the walls. Next is the occlusal reduction for the capping cusp. It should be 1.5 to 2 mm. Then the amount of axial wall reduction for the ceramic or composite restoration is 1 to 1.5 mm. All margins should have a 90-degree cavo surface angle and line angle and point angle should be well rounded to avoid any stress concentration. So in the picture you can see the occlusal reduction marked. So there should be an adequate amount of space for the material to hold or withstand the occlusal stress later once the tooth is restored, and there should be a 90-degree cavo surface angle and line angle and point angle should be rounded to avoid any stress concentrations. So the preparations can be done with a carbide burr or a diamond burr. Carbide burrs are good for dentin cutting as well as diamond burrs are good for enamel cutting. So the carbide burr or diamond burr can be used for tooth preparation and there should be a divergent facial and lingual walls. So gingival occlusal divergence should be greater than 2 to 5 degrees so that there won't be any undercuts. Any isthmus and any groove extension be at least 1.5 mm wide to decrease the possibility of the fracture. Small undercut if present can be blocked out by glass ionomer cements and pulpal flow should be smooth and flat. Following removal of extensive caries from any internal wall, the wall is restored to more nearly ideal form with glass ionomer cement. So basically if there is any caries, make sure it is excavated, and if you are not able to incorporate that caries into the restoration, then it has to be filled with a glass ionomer cement to get that 2 to 5% occlusal divergence. Then coming the proximal box, the facial, lingual and gingival margins of the proximal boxes should be extended to clear the adjacent tooth by at least 0.5 mm. Take great care to have the minimum possible extension of the gingival margin since the margins in enamel are greatly preferred for bonding. When the facial or the lingual surfaces are affected by caries or other injury, extend the preparation with gingival shoulder to include the defect. So make sure you have a 0.5 mm clearance with the adjacent tooth, because one of the advantage of the indirect tooth colored restorations are good contact and contours can be reproduced. So adequate amount of space should be left for that preparation, for that restoration. Then make sure try to keep the margins above the gums to have a good bonding towards the enamel. When it goes beyond the gingiva, then sometimes the restoration might be compromised. So that's all about the tooth preparation. Now coming to the impression. Impression is always take with elastomeric impression materials, so preferably adhesion silicones can be used. For onlays or large inlays, take impression for the opposing arch for bite registration as well. So make sure the impression for the prepared tooth is taken adhesion silicone, and the opposing arch you can use for the alginate impressions, so that you can make sure the contacts as well as the occlusions are checked properly. In case of digital recording, the intraoral scanner is placed opposite to the prepared tooth. That means by the help of intraoral scanner, the prepared tooth is completely scanned around all the surfaces and make sure the occlusion and the contacts areas are covered. Thereby, you complete the sequence of recording that prepared tooth, and at the same time you can visualize that recorded tooth surface in the computer screen. We spoke about this one in CAD CAM. So like that you have to record, make sure the prepared tooth is completely recorded into the computer screen. Once it is done, you can stop the impression, digital impression taking, and go ahead for the shade selection. Shade selection. So it is always better to take the shade selection before the procedure starts. So basically before the tooth preparation we have to start with the shade selection. So first you have to make sure the tooth is free of any saliva and water. After that, if you are going for the digital shade guide, then in the picture you can see the top one, it's something like a composite head. So you have to take that digital whiter shade guide, then you have to snap on to the infection control tip to the tip of the instrument. After that you have to place that head into the machine and you have to calibrate. You have to just place it, it calibrates automatically. After that you can take it, and there are few functions. So you can take the shades like cervical, facial and incisal, or just an normal shade you can take. So according to that settings you can fix it, and after that you just attach to the desired tooth. For example, one you just keep on next to that tooth and press the button on top, so it automatically says what shade it is. So it's so easy to do, but at the same time it might be expensive, and whatever the shade it gives, the laboratory, the work you are giving to the lab, it has to be done in this with the same Vita shade guide. So coming to the normal one, how you do manual one, make sure the tooth is free of any saliva and water, and the tooth should be at the level of the dentist eye, and by using the normal Vita shade guide you can compare the tooth and the color, and finally you come to a shade and you can select it there. That is about the shade guide. So it is always better to do it before the procedure. So tooth preparation is done, impression is taken, and shade selection is done. So the last step in the first setting is temporization. So advantages: the temporization protects the pulp dentin complex in vital teeth, maintains the position of the prepared tooth in the arch, and protects the soft tissue adjacent to the prepared areas. Sometimes when you do the preparation and it is very close to the dentin, sometimes patient might find very difficult. So in that case, temporization should be a proper one to fix the problem. So make sure you do the temporization and use an appropriate material. Always use a non-eugenol luting agent such as tampon, because if eugenol is used later when you do the permanent restoration, it might hinders the bonding. So make sure you use a non-eugenol agent. So next is veneers. So veneer is a thin layer of composite or dental porcelain bonded to the tooth surface. So it is indicated in discoloration such as tetracycline or a chipped off enamel, closing of diastemas, and if there is any irregularities with the anterior teeth. So basically it is an aesthetic treatment. So coming to tooth preparation of veneers. So it has four aspects. One is the labial reduction, interproximal reduction, incisal reduction, and cervical definition. So first is placement of horizontal facial depth cut. It's usually 0.3 mm to 0.5 mm from proximal line angle to the proximal line angle. So after this, make this depth cuts at the junction of the cervical middle one third of the facial surface of the tooth. Then the paralleling the entire gingival margin, prepare a definitive chamfer finish line. After that, the definitive chamfer line with a diamond burr from the papilla tip towards the incisal edge on the both the mesial and the proximal surfaces are prepared. Then the facial depth cuts are removed with the diamond burr, and the long axis of the diamond burr is rolled into the proximal chamfer area to eliminate any sharp line angles. Next is how to handle the incisal edge. So there are three ways. First one is the no incisal edge coverance, that is the first picture. Second is the cover the incisal edge, that is the second picture. And the third one is the wrap around the incisal edge. So non incisal edge coverance, so it is the easiest to prepare and there won't be much changes after the tooth is prepared. Second one is the one which, if the internal line angles are rounded properly, there won't be much stress for the veneers, and it is more commonly used in central incisors. Then the third one is the wraparound incisal edges. If there is a wearing of tooth structure over the incisal edge is there, or the incisal edge is improper, then you can go for this kind of wraparound incisal edge preparation. And it is also indicated if the buccolingual width of the tooth is more, and it provides adequate mechanical retention for the veneer as well. So that's about the first sitting. So in that we'll cover tooth preparation, impression, temporization, and shade selection. Coming to the second appointment, in that we will do the trying and luting of the restoration, finishing, and polishing. So first is trying. Remove the temporization first. After that, your restoration is placed into the cavity or the prepared tooth surface. Then you check for any high points. Use the carbon paper, and if there is any high points, it has to be removed before luting. Once it is ready, isolate the tooth and do selective etching of the enamel to prevent the sensitivity after the restoration, post-operative sensitivity after the restoration. So make sure the selective etching is done over the enamel surface. Once the selective etching is done for 15 seconds, remove the etchant and dry the tooth surface. Then after that, isolate it and apply the luting agent, that should be the resin cement. And once the resin cement is applied over the tooth surface, take the inlay or onlay or the restorative material, then placed into the tooth surface, and it is seated properly. Once it is seated properly, flush of material will come through the margins of the restoration. It can be removed with the help of small sponges, or you can use a floss for removing the interdental flush. Once it is removed, then you can light cure it for setting. Once it is set, you have to take a small polishing burr and remove the high points or the cement present over the margins over the restoration. Once it is done, the polishing procedure is done. So that's all about the indirect tooth colored restoration. Next is composite resin inlays and onlays. So stepwise indirect resin inlays and onlays. So the first thing is, again, you have to prepare the impression. Before that, you have to do the tooth preparation. So any caries or any weakened restoration, that has to be removed first, and tooth preparation has to be done. Then parallelism should be there for the preparation. At least a small taper should be given, occlusal taper should be given. If there is any undercut, that has to be blocked with a glass ionomer cement. Once it is done, impression is made, and cast is poured. That is the first appointment. Next one, the impression is sent to the laboratory. So the master cast is prepared from that. In laboratory, the restoration is fabricated on the die and the final restoration is finished and polished. So the final prepared restoration has good contacts and contour comparing to the normal direct restoration, and the polymerization shrinkage can be reduced. Once the restoration is ready, you can call the patient and load it to the oral cavity. So first you have to remove the temporary restoration. After that, check for any high points and seating. Once it is seating properly, use the resin cement and it is loaded to the tooth surface. You can do the selective etching to prevent the postoperative sensitivity. So after that, place the resin cement, then you place the restoration on top of the resin cement and it is seated properly to the prepared tooth. Once it is seated properly, make sure the excess cement is removed with the help of floss from the interdental surface, and you can make sure the occlusal surface is also removed. The excess material from the occlusal surface is also removed with the help of a small gauze piece or small sponges. Once it is done, you can light cure the resin cement for 40 seconds. Once it is ready, take a small polishing bar and make sure the excess materials over the margins of the restoration is removed properly and patient is free of any high points. So you can finish off the restoration with that. So that's all about indirect tooth cloud restorations. I hope you all understood that. If you have any doubts, you can contact me. Thank you.